The air in Apex Medical Center hummed with the oppressive drone of prestige and power. Here, protocol was God, and hierarchy an unshakable creed. Sasha Popova, barely a shadow in her pristine rookie scrubs, stood quietly at the periphery, her gaze fixed on Aisha Abdi. The young woman lay pale and still, a ticking time bomb of acute type A aortic dissection. Dr. Kenji Tanaka, chief of cardiac surgery, a man whose reputation preceded him like a thunderclap, surveyed the room with an imperious stare. "Nurse, ensure those monitors are perfectly calibrated," he snapped, not quite looking at Sasha, but at the general space she occupied. Dr. Layla Khatri, ambitious and sharp-edged, adjusted her mask, a flicker of disdain crossing her eyes as she glanced at the quiet new arrival. They saw a meek rookie, a pair of calm, deep-set eyes, however, saw critical nuances everyone else missed, and knew, with a certainty colder than steel, that today, the rules would shatter, and she would be the one to pick up the pieces. The frantic ballet of modern medicine was about to meet the raw grit of survival. The pre-op bay at Apex Medical Center wasn't just a room, it was a cathedral of cutting-edge technology, its polished chrome glinting under the harsh surgical lights, monitors humming a constant, low-frequency prayer. Every piece of equipment screamed efficiency, precision, and an almost religious adherence to protocol. For Sasha Popova, the stark contrast between this sterile perfection and the chaotic, resource-starved fields where she'd once saved lives felt like a constant, low-grade thrum of dissonance. Here, hierarchy was as ingrained as the hospital's pristine foundations, a quiet nurse was a ghost, a chief surgeon a god, and Sasha, still fresh in her rookie scrubs, was little more than a whisper. Her gaze, however, didn't follow the meticulous movements of the senior staff. It was locked onto Aisha Abdi, the young woman whose life teetered on the brink. Aisha's type A aortic dissection was a silent predator, and Sasha, with an intuition forged in the crucible of combat, felt its claws tightening. Dr. Kenji Tanaka, chief of cardiac surgery, moved with the measured confidence of a maestro, his voice a low, authoritative rumble as he issued instructions. "Ensure all lines are patent, nurse. We cannot afford even a millisecond of delay once we're in the OR." He addressed the room, not Sasha specifically, yet his pronouncements echoed with an implicit dismissiveness that was common towards junior staff. Dr. Layla Khatri, an ambitious surgical resident whose ambition was only outmatched by her adherence to convention, hovered nearby, her eyes scanning Aisha's vitals on the main monitor. "Patient remains stable for transport, Chief," she reported, a practiced neutrality in her tone. But Sasha, whose quiet observation missed nothing, noted the faint tremor in Khatri's gloved hand, a subtle sign of the underlying tension that permeated the room. Then, Aisha's condition took an insidious turn. It began with the subtle shift in the ECG tracing, a slight, almost imperceptible variance that would have been dismissed as artifact by anyone not looking for it. Sasha's eyes narrowed. The QRS complexes, usually uniform, began to show a beat-to-beat alteration in height, electrical alternans, a flickering warning sign of increasing fluid around the heart. Her heart hammered with a familiar dread. "Cardiac tamponade." "Dr. Tanaka," Sasha began, her voice barely above a murmur, her hand hovering near the monitor. "I'm seeing some changes in the ECG. Electrical alternans, specifically." Tanaka, preoccupied with reviewing the latest echo images on a tablet, barely registered her. "Nurse, focus on maintaining the patient's airway. Any variations are likely pre-op anxiety. The dissection is our primary concern." His tone was polite, but utterly dismissive, like swatting a fly. Khatri, however, turned to Sasha, a sharp, appraising glance in her eyes. "Nurse Popova, the chief has a protocol. We stick to it. Electrical alternans can be spurious. Maintain the patient's comfort." The underlying message was clear: know your place. Sasha felt the familiar prickle of frustration, but years of disciplined silence had taught her patience. She moved closer to Aisha, gently placing her stethoscope against the young woman's chest. Her training had taught her to listen not just for the sound, but for its absence. The rhythm was still there, but the thumping of Aisha's heart was growing distant, muffled, like a drum played behind a thick curtain. The pressure of the accumulating blood in the pericardial sac was squeezing the life out of Aisha's heart. Simultaneously, she noted Aisha's neck veins, subtly distending, barely visible but there. Her pulse pressure, the difference between systolic and diastolic readings, was starting to narrow, a dangerous trend that the main monitor, configured for broad alarms, hadn't yet flagged as critical. The heart sounds are becoming muffled, Chief, Sasha tried again, louder this time, her gaze locking onto Tanaka's back. And the pulse pressure is narrowing. I believe we're seeing signs of acute cardiac tamponade. Tanaka finally turned, a flicker of irritation crossing his features. Nurse Popova, I appreciate your attentiveness, but our current focus is the aortic dissection. We are preparing for a comprehensive surgical repair. We will reevaluate for tamponade in the OR with a transesophageal echo if indicated. Dr. Khatri, confirm all pre-meds are administered. He spoke over Sasha, his voice cutting off her warning, effectively reducing her to background noise. Khatri, emboldened, shot Sasha a condescending look. Acute tamponade is a grave diagnosis, nurse. It requires more than a feeling. We have a CT angiogram, a full panel of labs. Dr. Tanaka has ordered a stat bedside echo. It's coming now. Let's not jump to conclusions without the data. The bedside echo was coming, but Sasha knew it would be too late. The minutes ticking by weren't just minutes, they were heartbeats, each one fading, each one bringing Aisha closer to the precipice. Sasha's mind flashed back to a makeshift clinic in a war-torn village, the desperate scramble for basic supplies, the raw instinct required to save a life when the protocols were meaningless. Trust your eyes, trust your hands, trust what the patient tells you, even when they cannot speak. Aisha's breathing became shallower, more labored. Her skin, already pale, took on a clammy sheen. The main monitor finally caught up, shrieking a low-priority alarm as Aisha's systolic blood pressure dipped below 90 millimeters of mercury, then 85. Her heart rate, in response, began to climb, a desperate attempt to compensate. Her BP is dropping, rapidly. Khatri exclaimed, a note of genuine alarm finally entering her voice. She quickly adjusted the monitor settings, zooming in on the cardiac waveform. And look at the ECG. The electrical alternans is more pronounced. Tanaka's brow furrowed, his earlier confidence now tinged with a growing unease. Get that echo tech in here now. Prep for a stat TEE in the OR. We need to confirm the extent of the tamponade. Nurse Popova, push a rapid fluid bolus, 500 milliliters NS wide open. He was scrambling now, but still within the confines of established protocol, seeking confirmatory diagnostics before intervention. Sasha nodded, her hands moving instinctively to the fore-pump, but her mind raced. A fluid bolus would do little to relieve the pressure squeezing Aisha's heart. It might even exacerbate the problem by increasing venous return against an already compressed ventricle. The echo, the TEE, they would take precious minutes Aisha didn't have. The predator was no longer silent, it was roaring. The room, once so controlled, was beginning to fray at the edges, the frantic ballet of modern medicine teetering on the brink of chaos. The rapid fluid bolus, intended to stabilize Aisha, instead seemed to act as a cruel accelerant. The physiological principle was simple: increase volume in an already compressed chamber, and the pressure only intensifies. Aisha's already struggling heart, encased in a suffocating sack of blood, had nowhere left to expand. The monitor's cheerful, rhythmic beeps turned into a frantic, high-pitched shriek. BP 70/40. Matteo called out, his voice now laced with undisguised panic. Heart rate spiking to 160, then dropping, it's erratic. Sasha's eyes, usually a calm pool, sharpened to pinpricks of intense focus. She moved instantly to Aisha's side, ignoring Tanaka's increasingly agitated commands for more diagnostics. Her fingers pressed firmly against Aisha's neck. The jugular veins, already prominent, were now distended, bulging visibly, a serpentine network throbbing beneath the skin, a textbook sign of increased central venous pressure. Beck's triad was coalescing before their eyes, a grim symphony of impending cardiac collapse. Dr. Tanaka, her JVD is incredibly distended, Sasha stated, her voice cutting through the rising din, calm despite the chaos erupting around her. Her peripheral pulses are almost imperceptible. Tanaka, his face drawn tight with a combination of frustration and fear, barely registered her words. He was barking into his communication device. "Where is that echo machine? I need it here, now. Prep a pericardiocentesis tray for the stat." He turned to Katri. "Dr. Katri, push 1 milligram atropine. Let's try to bring that heart rate up, then another bolus." Katri, flustered, fumbled with a syringe. "But doctor, her BP is still tanking. Won't another bolus worsen the tamponade?" Her question was hesitant, a flicker of doubt in her protocol-driven mind. "We don't have time for theory, doctor. Just follow orders." Tanaka snapped, his usual composure completely shredded. He was still caught in the loop of standard response, the need for confirmation blinding him to the obvious. He wanted a perfect diagnostic image, a precise surgical field, before daring to intervene. But Aisha had no time for perfection. Sasha knew Katri was right. Another bolus, atropine for a heart already being choked, these were futile gestures, treating symptoms while ignoring the root cause. Aisha's heart wasn't just under pressure, it was being strangled. "Sats are 75, Dr. Tanaka. Now 70. Mateo's voice cracked. The oximeter probe on Aisha's finger showed a terrifying descent into hypoxia. Aisha, who had been barely conscious, now gasped, a series of weak, rattling breaths, her chest barely rising. Her lips were turning blue. Sasha leaned in, pressing her stethoscope against Aisha's chest once more. What little muffled sound had been there before was now almost entirely absent. The heart sounds were gone, swallowed by the accumulating blood in the pericardial sac. It was like listening to a heartbeat through a thick, wet blanket, except now, the blanket was a lead coffin. "Her heart sounds are completely absent, Dr. Tanaka," Sasha announced, her voice flat, devoid of emotion, a stark contrast to the escalating panic around her. She was not asking, she was stating a fact, a dire pronouncement. "We have Beck's triad. She's in full cardiac tamponade. The OR will be too late. The echo will be too late." But Tanaka wasn't listening. He was staring at the monitor, his eyes wide with disbelief as Aisha's ECG showed a terrifying progression. The electrical alternans, once subtle, was now pronounced, then devolved into wide, bizarre QRS complexes. Then, the rhythmic spikes flattened. The monitor let out a single, prolonged, piercing wail. Asterisk beep. Beep asterisk. Aisha's eyes rolled back. Her body went limp. "She's flatlined." Katri shrieked, dropping the syringe. Pulseless electrical activity. The room erupted. Nurses rushed forward, a tangle of bodies and frantic movements. "Code blue," someone screamed. "Start compressions." "No pulse." Mateo confirmed, feeling for Aisha's carotid artery, his face stark white. Tanaka stood frozen, staring at the monitor's flat line, his brilliant mind temporarily crippled by the overwhelming catastrophe and the failure of all his protocols. "CPR. Someone start CPR," he bellowed, finally snapping out of his stupor, but his command was a desperate reflex, another standard procedure in a situation that had already surpassed standard. Sasha watched the chaos, her combat medic training kicking in with icy precision. CPR wouldn't help. Not when the heart was compressed. It was like trying to pump water from a hose with a foot on the nozzle. Every wasted second was another nail in Aisha's coffin. She saw the despair in Tanaka's eyes, the unadulterated terror in Katri's. They were out of options, out of time, clinging to the last vestiges of conventional medicine as Aisha's life slipped away. The air thrummed with the desperate energy of a sinking ship. Alarms blared. Bodies jostled. Yet, in the eye of this hurricane, Sasha Popova stood absolutely still, her gaze fixed on Aisha Abdi's lifeless form. Her mind had already calculated the risks, weighed the odds, and landed on one terrifying, unconventional, but ultimately necessary solution. The whispers of doubt, the fear of censure, the strict hierarchy of Apex Medical, all of it faded. All that remained was Aisha, and the faint, almost imperceptible memory of a pulsing jugular, a landmark. She drew a deep breath, the smell of antiseptic and fear filling her lungs. This wasn't a war zone, but the stakes were just as high. And she was the only one who saw the path forward. Everyone, Sasha's voice cut through the pandemonium, not loud, but imbued with an authority that silenced the room in an instant. Breathe. Listen to me. Sasha's voice, a steady anchor in the storm, sliced through the frantic air. Aisha needs an immediate pericardiocentesis. Blind, within 4 catheter. Now. Dr. Tanaka's eyes narrowed, disbelief warring with anger. Nurse Popova, that's absurd. Reckless. Dr. Khatri let out a derisive snort. This isn't some back alley, nurse. We follow protocols. They saw only a rookie, but Sasha saw the vanishing seconds. If you're rooting for the underdog to defy the odds and prove them all wrong, don't forget to hit that subscribe button. The words hung in the suffocating air, a fragile tether across the abyss of panic. For a beat, perhaps two, an unnatural silence descended, broken only by the frantic peep-peep-peep of the cardiac monitor, a chillingly steady rhythm that mocked Aisha's sudden stillness. Then, with a mournful, drawn-out beep, the steady line of a flat line seared itself across the screen. A collective gasp ripped through the room. Aisha Abdi, who just moments ago had been clinging to a thread of life, was gone. Her chest compressions had become futile thumps against a body that offered no resistance, her skin taking on the mottled, ashen pallor of irreversible cardiac arrest. Charge! Dr. Tanaka bellowed, his face a mask of desperate fury, already reaching for the paddles. Give her AP. CPR, now. The familiar, desperate ballet of resuscitation began anew, chest compressions that seemed to merely jolt a lifeless mannequin, the rhythmic squeeze of the ambu bag, the frantic injections of life-saving drugs into a vein that no longer pulsed. But Tanaka's voice, usually a command, now had a raw edge of despair. He knew, as did Dr. Khatri, whose own face had gone ashen, that they were merely going through the motions. Electrical alternans had been the warning, muffled heart sounds the harbinger, but cardiac tamponade, swift and merciless, had claimed Aisha before their conventional arsenal could even be deployed. She was bleeding out, not outwardly, but internally, her own heart being crushed by the blood pooling around it. No amount of external electrical current or pharmacotherapy could solve a mechanical problem of this magnitude. No! Sasha's voice, sharper now, cut through the renewed pandemonium. She moved, not towards the flatlining patient for compressions, but directly into Tanaka's line of sight, her stance unwavering. Dr. Tanaka, it's tamponade. She's flatlined because her heart can't pump, not because it's electrically silent. CPR won't restart a heart that's physically compressed to death. Her eyes, usually so discreet, now blazed with an almost unsettling intensity. We have to decompress her. Now. We're losing time we don't have for the oar. Tanaka paused, the paddles in his hands, his eyes narrowing. Nurse Popova, what are you suggesting? Pericardiocentesis? Without imaging? That's reckless. It's an oar procedure, not a floor improvisation. We risk lacerating the myocardium, puncturing a lung, perforating the liver. His voice was tight, each word a desperate plea for adherence to protocol, for the safety of established practice. This isn't some back alley clinic, this is Apex Medical. His professional identity, his years of training, recoiled at the sheer audacity. With respect, Doctor, Sasha countered, her gaze unwavering, this is an emergency. We don't have time for the oar. We don't have time for an echo. She will die if we wait. Her eyes flickered to Aisha's still form, then back to Tanaka. I can do it. Within 4 catheter. Right here. Right now. The calm certainty in her voice was stark against the panicked urgency of the room. Dr. Khatri, who had been observing with a mixture of horror and professional affront, scoffed. A blind stick within 4 catheter? Nurse Popova, are you serious? That's antiquated. Barbaric, even. We have ultrasound guidance, we have thoracotomy trays ready for surgery. You're talking about a procedure that carries an unacceptable risk of complications, even for an MD, let alone without a clear view. Her voice was shrill with indignation and fear of the unknown. The accusations, the disbelief, the palpable fear of malpractice hung heavy. Sasha ignored them. Her focus was absolute. She wasn't asking for permission, she was stating a fact, an undeniable truth born of dire circumstance. The risk of not doing it is 100% mortality, doctor, she articulated, her voice a low, steady current in the swirling chaos. The risk of perforation is present, yes. But I've done this before. In far worse conditions. With fewer resources. She has electrical alternans, muffled heart sounds, plummeting BP and now PEA, pulseless electrical activity. It's cardiac tamponade. The pericardium is full of blood. We must drain it. Tanaka stared at her, his mind racing. Every fiber of his being, every year of his rigorous training, screamed no. The liability, the audacity, the sheer break from established, evidence-based practice in an elite institution. But Aisha was flatlined. CPR was futile. AP was useless. The OR was still minutes away, and by then, it would be too late. He looked at the still patient, then at the confident, unshakable nurse. He saw no tremor in her hands, no flicker of doubt in her eyes, only an iron certainty. He was out of options. His brilliant mind, accustomed to solving the most complex cardiac puzzles, was now facing a brick wall of futility. Desperation was a bitter taste in his mouth. Dr. Tanaka, please, Sasha pressed, her voice softened slightly, a plea wrapped in absolute conviction. Give me 3 minutes. If I can relieve the pressure, she has a chance. A fighting chance. His shoulders sagged. His jaw tightened. The words, when they came, were ripped from the depths of his professional ethos, a surrender he never thought he'd make. Do it, nurse, he ground out, the command laced with a desperate, bitter edge, an implicit understanding that he was stepping into uncharted, professionally perilous waters. But if anything goes wrong... He didn't finish the threat, the implications hung heavy in the air, a sword of Damocles over Sasha's head. Sasha didn't acknowledge the unspoken warning. There was no time. Mateo, she snapped, her eyes already scanning the nearby crash cart. Mateo Cruz, the supporting nurse, a man usually unflappable but now wide-eyed with apprehension, jumped. I need an 18-gauge 4 catheter, a 20-milliliter syringe, a 3-way stopcock, and a local anesthetic, lidocaine 1% with AP. Stat. And sterile gloves, mine. Mateo, galvanized by her sudden, undeniable authority, moved with a speed he didn't know he possessed. The team, previously scrambling, now froze, watching in stunned silence as the rookie nurse took command. CPR continued, a rhythmic backdrop to the unfolding drama, but their eyes were fixed on Sasha, a lone, unyielding figure at the center of the storm. She pulled on the gloves Mateo handed her, her movements precise, economical. Her gaze swept over Aisha's chest, mentally mapping the topography. This was where her hidden knowledge, honed in the chaotic, resource-scarce battlefields, truly shone. The sternum, the xiphoid process, the costal margins, these weren't just anatomical terms. They were a three-dimensional map, etched into her muscle memory, guiding her hands. She leaned in, her ear close to Aisha's chest, listening, not for a heartbeat, which was absent, but for the subtle, almost imperceptible shifts in resonance, the dullness of fluid against the faint, residual whoosh of air being pushed into the lungs by the ambu bag. She felt for the point of maximal impulse, usually a vibrant indicator of cardiac activity, but now a faint, almost non-existent tremor obscured by the fluid. The chaos in the room had receded, replaced by a suffocating quiet, punctuated only by the whoosh thump of CPR and the high-pitched beep of the flatline. Every eye was on Sasha. Dr. Khatri looked on, her initial skepticism now warring with a morbid curiosity, an unwilling fascination. Dr. Tanaka, his arms crossed, jaw tight, watched like a hawk, ready to intervene at the slightest sign of error, his reputation, his patient's life, all hanging on this audacious gamble. Sasha tipped the 18-gauge catheter, securing it to the syringe. The lidocaine was drawn up. She prepared the skin, a quick swipe of antiseptic. "Stop compressions for 30 seconds, she ordered, her voice calm, utterly devoid of tremor. The CPR provider paused, hands hovering. The woo-stump ceased. The silence became absolute, save for Aisha's defiant, unwavering flatline. Sasha leaned in again, her fingers gently, expertly palpating the infrasternal angle, just below the xiphoid process, aiming for the angle between the xiphoid and the left costal margin. Her mind flashed back to a makeshift tent under a scorching sun, the faint tremor of a casualty's chest, the smell of dust and blood. No fancy equipment then. Just knowledge, touch, and an unshakable resolve. She remembered the specific physical landmarking technique, the angle, the depth, the slight upward and leftward trajectory to avoid the diaphragm and target the pericardial sac. It was a precise dance, a deadly ballet between anatomy and intuition. Her thumb found a subtle depression, a soft spot where the cartilages met. Her index finger traced the curvature of the rib cage. The internal architecture of Aisha's chest materialized in her mind's eye, a holographic projection of organs, bones, and the treacherous, fluid-filled space she needed to access. "This is madness," Dr. Katra whispered, though no one paid her any mind. Sasha didn't flinch. She infused a small amount of lidocaine into the chosen spot, creating a small bleb on the skin, a tiny island of numbness in a sea of critical pain. Her eyes closed for a brief instant, a micro-meditation, a final check of the mental map. Then, they snapped open, sharper than before. Her hand, holding the catheter, was steady as a rock. The fate of Aisha Abdi, and perhaps Sasha Popova's own career, hung in that single, precise moment. Sasha picked up the 16-gauge 4 catheter. It looked absurdly small, a flimsy plastic tube with a thin metal stylet, against the enormity of Aisha's crisis. The sterility of the moment was almost comical, overshadowed by the grim reality of the situation. Her hand, preternaturally steady, hovered over the xiphocostal angle, the indentation where the lowest part of the sternum met the ribcage. It was the subxiphoid approach, a gateway straight to the heart, but one fraught with peril. No ultrasound probe guided her, no bright image on a screen showed her the distance to the fluttering myocardium, the exact location of the fluid sac. Just her touch, her memory, and her absolute conviction. She connected a 10 milliliter syringe to the catheter hub, ensuring a tight seal. This wasn't just for aspiration. The gentle negative pressure would help her discern tissue resistance changes, a vital guide in the absence of sight. Her gaze, a laser-like beam, swept from Aisha's chest to the cardiac monitor, then back. The ECG was a frantic scrawl of electrical alternans, the R-wave amplitude varying beat to beat, a classic, terrifying sign of a swinging heart within a fluid-filled sac. Blood pressure was an anemic 60/30 mmHg, a whispered promise of impending doom. "Matteo," Sasha's voice was a low hum, cutting through the ambient hum of the monitors and the panicked breathing of the team. "Keep the pressure bag ready. And watch her pupils." Matteo, his face a mask of concentrated fear, nodded, gripping the blood pressure cuff. He knew the drill. Even if Sasha hit the pericardium, the sheer volume of blood could still be too much for Aisha's compromised system. Sasha took a deep, deliberate breath, her chest rising and falling imperceptibly. Her eyes, usually so soft, were now hard, glinting with an intensity that seemed to absorb all the light in the room. She angled the catheter precisely, the needle bevel facing upwards, a subtle tilt of perhaps 45 degrees relative to the skin, pointing superiorly and leftward, towards Aisha's left shoulder, away from the liver and the right ventricle. This was the narrow corridor, the path of least resistance, the route her hands remembered from countless makeshift procedures under the harshest conditions. With a firm, controlled motion, she advanced the catheter through the skin and subcutaneous tissue. A barely audible pop as it pierced the fascia, a sensation only she seemed to register. Dr. Tanaka, who had been leaning forward, his eyes narrowed, now visibly flinched. Dr. Khatri made a small, choked sound, her hand flying to her mouth. They were used to controlled environments, to surgical incisions and imaging guidance. This was an act of brutal, clinical faith. Depth, Sasha murmured, more to herself than anyone else, her brow furrowed in concentration. Her thumb and forefinger, straddling the catheter, gauged every millimeter of advancement. She was feeling for the subtle changes in tissue resistance, the slight give of muscle, the denser feel of cartilage. Each micro-movement was calculated, each breath held in synchrony with Aisha's labored gasps. The room was utterly silent now. The only sounds were the persistent, mournful beeps of the monitors and Aisha's shallow breathing. Every eye was on Sasha's hand, a tiny, fragile beacon of hope or impending disaster. Tanaka, a man known for his unflappable demeanor, had a sheen of sweat on his forehead. His arms, usually crossed, hung stiffly at his sides, his fists clenched. Khatri looked as if she might faint, her eyes wide with a mixture of horror and fascination. Sasha advanced further, slowly, meticulously. She pressed gently on the syringe plunger, then released, creating a slight vacuum. She was feeling for a loss of resistance, a sudden yielding of tissue, like passing through a tough membrane into an empty space, the pericardial sac. But it was never truly empty. It would be filled with blood, thick and viscous. No, 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 Dr. Khatri whispered, almost inaudibly, her voice trembling. She could puncture the myocardium. Or the lung. This is insane. Tanaka didn't answer. He was watching Sasha's face, a steady and absolute calm. He had seen fear, panic, and even resigned despair in emergency situations. He had never seen such a terrifyingly serene focus. It was the look of someone operating on a plane beyond the current chaos. Sasha's hand, like a divining rod, moved with minute adjustments. She felt the dense, fibrous layer of the rectus abdominis, then the tougher, more yielding fibers of the diaphragm, which the angle helped her skirt. Her mental map, built on years of training and experience where imaging was a luxury, not a given, was guiding her. She was a human sonar, navigating by touch and memory. Her ear, though not pressed to Aisha's chest, was listening for any change in the muffled heart sounds. The absence of a clear, resonant thump was the problem, but any sudden, distinct sound might mean she was too close, or worse, in the heart muscle itself. She had to stay within the narrow margin, within the fluid-filled sac. She felt a subtle give, distinct from the previous tissue layers. It was softer, more yielding, a sensation that told her she had passed through the pericardial parietal layer. Her fingers, still gripping the hub, exerted the slightest negative pressure on the syringe plunger. If she was in the right place, she would pull back blood. If she was in the heart, the blood would be arterial, bright red, and she'd see immediate, devastating ST elevation on the ECG. The seconds stretched into an eternity. The hum of the monitors, the frantic, shallow breaths of Aisha, the collective held breath of the medical team, all amplified in the profound silence. Sasha's focus was absolute, her every nerve ending tuned to the subtle language of the tissues beneath the catheter tip. The fate of Aisha Abdi, and indeed, the very reputation of Sasha Popova, teetered on this precise, blind plunge into the unknown. Sasha's fingers tightened ever so slightly on the syringe plunger. With a deep, almost imperceptible breath, she drew back. For a fraction of a second, the syringe remained stubbornly empty, a clear, cruel void. The air in the room thickened, stretching taut like an overtuned drum skin. Dr. Tanaka's jaw was clenched, his eyes fixed on Sasha's hands, a silent, desperate prayer battling his inherent skepticism. Dr. Khatri, usually quick with a sharp remark, was eerily still, her face pale, reflecting the impending doom. Every tick of the clock was a hammer blow against Aisha's fading life. Then, with an abruptness that made the entire team collectively flinch, a dark, viscous fluid surged into the syringe. Not the bright, pulsating crimson of arterial blood, which would have meant a catastrophic puncture, but a deep, purplish crimson, sluggish and non-pulsatile. It was pericardial effusion, thick with old blood, the insidious enemy that had been suffocating Aisha's heart. A profound wave of relief, so potent it felt physical, washed over Sasha. She was in. precisely where she needed to be. Blood. Matteo whispered, his voice hoarse with awe, staring at the syringe. A wave of hushed astonishment swept through the room, replacing the suffocating panic with a breathless, fragile hope. The pressure immediately began to drop as Sasha allowed the fluid to flow, a continuous, steady stream. She released the plunger, allowing the syringe to fill naturally, demonstrating the true, crushing pressure within the pericardial sac. As the initial 10 milliliters filled, Aisha's monitor, which had been flatlining, flickered with a hesitant, small QRS complex. Then another, slightly stronger. The electrical alternans, the chaotic dance of the heart's electrical axis, began to stabilize, the QRS complexes becoming more uniform, if still weak. The faint, struggling beeps of the cardiac monitor, previously an irregular, dying rhythm, found a tentative cadence. A collective gasp rippled through the room, followed by a sudden, profound exhalation, as if everyone had been holding their breath for an eternity. Dr. Tanaka's rigid posture sagged almost imperceptibly, his eyes widening as he stared at the screen, then at Sasha's unmoving hands. Dr. Catri's lips parted in utter disbelief. Sasha, ignoring the nascent commotion, smoothly detached the filled syringe, handing it to Matteo with a quiet, authoritative instruction, "Send for analysis, stat. And get me a 3-way stopcock and a drainage bag, quickly." Her voice, though low, carried an undeniable authority, cutting through the lingering tension. She attached a fresh syringe to the catheter hub, continuing the drainage. The dark, sanguineous fluid flowed freely, a macabre ballet of life returning from the brink. Aisha's skin, which moments ago had been an ashen, mottled gray, began to regain a faint flush, a delicate blush returning to her cheeks. The peripheral cyanosis around her lips and nail beds receded, replaced by a healthier pink. The tension in her jugular veins, previously distended and rigid from the sheer pressure, visibly lessened, the prominent pulsation softening, signaling the immediate relief of central venous pressure. On the monitor, the once muffled heart sounds now gained a subtle, distinct clarity, a faint but steady lube-dub echoing in the once silent chest, a heartbeat no longer struggling against an impossible vice. "BP's coming up," Matteo exclaimed, his voice cracking with emotion, the rigid silence of panic replaced by a raw, disbelieving joy. 70/40, 80/50, 90/60. The numbers climbed, slowly but steadily, each increment a tiny victory snatched from the jaws of despair. The radial pulse, which Tanaka had been desperately trying to palpate, now returned, faint at first, then strengthening, a palpable thrum against his fingertips. His head snapped up, meeting Sasha's gaze. In his eyes, the chief surgeon's usual arrogance was utterly absent, replaced by a raw, almost childlike astonishment. The unwavering resolve Sasha had displayed had shattered every one of his preconceived notions. Sasha maintained her unwavering focus. Her movements were economical, precise, each step executed with the practiced ease of someone who had done this countless times in far less forgiving circumstances. She ensured the catheter was securely positioned, not too deep to puncture the myocardium, not too shallow to dislodge. The faint gift she had felt earlier now confirmed her ideal placement within the pericardial space. She attached the 3-way stopcock Matteo handed her, securing the drainage line to a sterile bag. The dark fluid began to glug steadily into the bag, slowly but surely relieving the crushing pressure around Aisha's heart. With each milliliter drained, Aisha's physiological parameters rebounded further. The SpO2, which had hovered dangerously in the low 80s, climbed to 92%, then 94%. Her respirations, previously shallow and gasping, deepened, becoming more regular and less labored. She was still critically ill, but the immediate threat of mechanical cardiac arrest had been averted. The heart, once squeezed into immobility, was now beating with renewed, though still fragile, vigor. "How much drained?" Tanaka asked, his voice strained, almost a whisper, as if afraid to break the fragile spell. "Approximately 150 milliliters so far, Dr. Tanaka," Sasha replied, her voice calm, devoid of triumph or self-congratulation. "Looks like we can get another 200 to 300 milliliters easily without risk of hypotension from rapid decompression." She knew the delicate balance, too much, too fast, could cause its own set of problems. She kept the rate steady, measured. Tanaka stared at her, then at the flowing drainage, then back at the monitor where Aisha's vitals steadily improved. His mind, usually a fortress of logical, protocol-driven thought, wrestled with the impossible reality unfolding before him. He had dismissed her, scoffed at her suggestion, almost condemned her for her audacity. Yet, here was undeniable proof, a patient pulling back from the brink of death because of this rookie nurse's reckless method. His face, etched with the lines of stress and disbelief, slowly smoothed out, replaced by a dawning, humbling realization. The chief of cardiac surgery, known for his unshakable confidence and often dismissive demeanor, looked utterly bewildered, yet undeniably relieved. The gravity of Sasha's intervention, and its profound success, stripped him of his defenses. "Prep her for immediate transfer to the OR," Tanaka finally commanded, his voice regaining some of its usual authority, though tempered by a profound humility. "Dr. Khatri, inform the OR team we're coming up. And get ready to scrub." Dr. Khatri, jolted into action, nodded numbly, her gaze still flickering between Sasha and the drainage bag. The skepticism that had hardened her features just moments ago had completely evaporated, replaced by a stunned, respectful curiosity that bordered on bewilderment. She had scoffed, she had dismissed, and yet, the rookie nurse, armed with nothing but an IV catheter and an arcane skill, had just performed a miracle where established protocols and expert knowledge had failed. As the team efficiently began to mobilize Aisha onto the transport gurney, securing lines and preparing for the swift journey to the operating theater, Sasha remained by Aisha's side, monitoring the drainage, a steady hand on the patient's wrist. Only when Aisha was fully secured and ready for transport did Sasha finally step back, allowing the surgical team to take over. A subtle tremor ran through Sasha's own hand as the adrenaline, which had been a cold, precise current through her veins, began its slow, inevitable withdrawal. Her fingers, which had performed with such flawless dexterity, now felt a faint ache. The metallic tang of fear and blood, the overwhelming odor of antiseptic and panic, slowly began to recede, replaced by the sterile hum of the hospital. She had done it. Against all odds, against the skepticism of her superiors, she had cut through the chaos and saved a life. The technique, scorned as archaic, had been Aisha's only lifeline. Tanaka paused beside Sasha, just as the gurney was about to move. His gaze, usually sharp and critical, was softer now, tinged with a grudging respect that bordered on awe. "Nurse Popova," he began, his voice low, "that was unconventional." He hesitated, searching for the right words. "You saved her. You truly saved her." It was not a question, but a stark, undeniable declaration. The words, uttered by the chief of cardiac surgery, were more potent than any formal commendation. Khatri, still reeling, passed by, her eyes meeting Sasha's. Her initial dismissal now seemed a lifetime ago. "How," she started, her voice barely a whisper, a genuine plea for understanding. "How did you know?" Sasha offered a small, tired smile. "Just experience, Dr. Khatri," she replied, her modesty already reasserting itself. She watched as Aisha, now with a steady pulse and more stable vitals, was swiftly wheeled out, a fragile victory carried toward definitive repair. The room, which moments ago had been a maelstrom of suffocating fear and desperate measures, now held the quiet hum of adrenaline's aftermath, a profound silence punctuated by the grateful breaths of a team reborn. The rigid hierarchy of Apex Medical had been subtly, yet irrevocably, shaken. A new, undeniable respect for the quiet rookie nurse, Sasha Popova, had just been etched into the consciousness of its most esteemed practitioners, a testament to the power of unconventional wisdom in the face of insurmountable odds. The hors d'oeuvres swallowed Aisha Abdi, the rhythmic thrum of the gurney wheels fading into the sterile silence. Sasha remained by the bedside for a moment longer, her hand still resting on the patient's pillow, a silent farewell to the immediate crisis. The IV catheter, now a crude but effective lifeline and a testament to her quick thinking, had been secured and handed over to the transferring team. A profound exhaustion, not just physical but mental, began to settle over her, the kind that follows the abrupt cessation of an all-consuming fight for life. The room, which moments ago had been a maelstrom of suffocating fear and desperate measures, slowly began to stir. Mateo Cruz, the supporting nurse, was the first to move, his face pale, eyes wide with a mixture of shock and awe. He approached Sasha, a tentative hand reaching out, then retracting as if unsure whether to touch a figure so suddenly elevated. "Sasha, that was... I've never seen anything like it," he whispered, his voice hoarse with emotion. Other nurses and junior residents, who had stood as frozen witnesses, started to murmur amongst themselves, their voices low, reverent. The palpable panic had evaporated, replaced by a profound relief that felt like a collective lung expanding after being held underwater for too long. Dr. Leila Khatri, still trying to process the impossible, watched Sasha. The casual dismissal she had harbored for the quiet rookie nurse had shattered, replaced by an unsettling blend of awe and a nascent sense of professional inadequacy. "Just experience," Dr. Khatri, Sasha had said, a deceptively simple explanation for what had felt like an act of medical wizardry. But what kind of experience could equip someone with such an almost psychic understanding of anatomy, such unwavering calm in the face of cardiac arrest? Khatri, trained in the most advanced protocols and steeped in the rigid logic of Apex Medical, couldn't reconcile Sasha's calm, precise action with any standard medical education she knew. The image of Sasha's hands, steady and confident, guiding the catheter into the exact, unseen point below the xiphoid process, was burned into her memory. A sudden hush fell again as Dr. Kenji Tanaka emerged from the hors d'oeuvres, his surgical scrub still on, a faint sheen of sweat on his brow. He didn't look at anyone directly at first, his gaze sweeping the room, then settling with laser focus on Sasha. The usual imperiousness that defined his bearing was softened, almost absent. He walked slowly towards her, his footsteps echoing in the suddenly cavernous space. The air was thick with anticipation. Everyone held their breath, wondering how the chief of cardiac surgery would address this unprecedented breach of protocol, this astonishing success born of desperation. He stopped a foot from Sasha, his hands clasped behind his back, a posture he often adopted when deep in thought or delivering an important diagnosis. "Nurse Popova," he began, his voice surprisingly soft, devoid of its usual sharp edge. "Aisha is stable. They're on bypass. We're proceeding with the repair." He paused, his sharp eyes finally meeting Sasha's, holding them. There was no condescension, no anger, only a raw, undisguised respect that seemed to ripple through the stunned onlookers. "You saved her life, nurse. There's no doubt about it." The words hung in the air, a formal pronouncement from the highest authority. It wasn't merely acknowledgement, it was absolute validation, direct and unequivocal, from the man who had initially dismissed her proposal as reckless, even dangerous. Sasha felt a flicker of warmth, but her expression remained serene, her posture professional. "I only did what was necessary, Dr. Tanaka," she replied, her voice calm, respectful, yet firm. "We were losing her to acute cardiac tamponade, the muffled heart sounds and electrical alternans on the ECG, her profound hypotension and distended jugular veins. The classic Beck's triad was screaming at us. Time was against us." Tanaka nodded slowly, a profound understanding in his gaze. "Indeed, it was. Our advanced tools, our meticulously crafted protocols, they were failing us. You saw what none of us dared to consider. That kind of foresight, that kind of nerve, it's rare. Especially in this environment." His eyes briefly flickered towards the gleaming, high-tech equipment surrounding them, a silent acknowledgement of their collective reliance on it, and its spectacular inadequacy in Aisha's dire moment. I was wrong to doubt you." The admission was quiet, almost a whisper, but it resonated with the weight of his considerable ego, a testament to the magnitude of Sasha's intervention. Dr. Khatri, unable to contain her curiosity any longer, stepped forward, her previous skepticism now replaced by an almost desperate need for understanding. "Dr. Tanaka, if I may. Nurse Popova, you mentioned experience. But, how? This technique, a blind pericardiocentesis with an 4 catheter, it's not taught in modern nursing, or even surgical residencies, not like that. Without imaging guidance, the risk of myocardial puncture, of hitting a coronary artery, it's considered almost malpractice." Her tone was no longer dismissive, but genuinely perplexed, searching for answers. Sasha turned to Katri, a slight shift in her posture indicating a willingness to explain, though still maintaining her quiet composure. "You're right, Dr. Katri," she acknowledged. "It's not. Not in places like Apex." She took a shallow breath, remembering a different world, a different kind of medical practice. "My training, it wasn't always in state-of-the-art facilities. I was a combat medic before I became an RN." A collective gasp rippled through the small group of onlookers. Combat medic. The words painted a sudden, stark picture: battlefield, improvisation, life-or-death decisions made with minimal resources. It explained so much: her calm under pressure, her ability to read subtle cues, her willingness to act decisively where others hesitated, bypassing layers of protocol with surgical precision. In those environments, Sasha continued, her gaze distant for a moment, lost in memories of sand and sirens, you learn to adapt. You learn to do things with what you have, not what you wish you had. Ultrasound? CT scans? Rarely an option. We learn to rely on our hands, our ears, our eyes. Physical landmarking, auscultation, the subtle shifts in a patient's breathing, the way their skin feels, the faint tremor of a pulse that's barely there, the precise angle of needle insertion through the left xiphocostal angle to avoid the pleura and peritoneal cavity. She demonstrated with a hand gesture towards her own chest, pointing to the substernal notch, the xiphoid process, outlining the safest entry point. The angle of the xiphoid process, the space between the ribs, with practice, you can feel the anatomy, hear the muffled heart, even without a machine. It's about understanding the body's response, not just the readouts from monitors. But the risk. Katri trailed off, still grappling with the concept of eschewing imaging. The chance of hitting the myocardium, perforating the ventricle, causing more damage. The risk of not doing it was 100% mortality, Sasha stated simply, unequivocally. When there are no other options, and a patient is actively dying from mechanical obstruction to cardiac filling, you weigh the known outcome of inaction against the potential outcome of intervention, however unconventional. You trust your training, and you trust what the patient is telling you, even when they can't speak. Her voice held no judgment, only a pragmatic truth honed in countless desperate moments. Tanaka, listening intently, interjected, "It's a forgotten art, Dr. Katri. Something from the early days of medicine, before imaging became standard. Few still possess that level of anatomical intuition, that confidence in tactile and auditory diagnostics alone. To perform it with such precision, knowing the pericardial sac's approximate location and the safest approach, it speaks volumes about her unique experience." He looked at Sasha with newfound admiration, a quiet fire in his eyes. "You carry an invaluable skill, Nurse Popova. We are fortunate to have you." Sasha acknowledged his praise with a respectful nod, a faint blush rising on her cheeks. "Thank you, Dr. Tanaka. I just saw a patient in distress and tried to help." Her modesty was genuine, not feigned. For her, it wasn't about heroics or praise, but about the fundamental duty to save a life, to relieve the pressure that was crushing Aisha's heart. Mateo Cruz, empowered by the chief's validation, spoke up, his initial shock now mixed with pride. "She was incredible, Dr. Tanaka. So calm. While we were all panicking, she just took charge." He gave a nervous laugh, a tremor of residual adrenaline in his voice. The atmosphere in the room had irrevocably changed. The quiet rookie nurse, previously overlooked, was now seen through a new lens. Her calm demeanor was no longer interpreted as shyness, but as deep composure. Her quiet observation, not as timidity, but as intense focus. The rigid, protocol-driven world of Apex Medical had just been forced to confront the limitations of its own dogma, and in doing so, had discovered a profound respect for a different kind of wisdom. Sasha Popova, the combat medic turned RN, had not just saved Aisha Abdi, she had subtly, yet fundamentally, shifted the very foundations of how her colleagues perceived medical expertise. The silent reverence in the room was her validation, a testament to a quiet strength that had triumphed over crisis. The hum of the recovery ward was a stark contrast to the previous day's frantic symphony of alarms and shouted commands. Aisha Abdi, though still fragile, was now stable in the ICU, post-op from a successful type A dissection repair, her future uncertain but no longer immediately grim. Her survival was a testament to the surgical team's skill, yes, but more profoundly, to the impossible intervention that had granted them the time to operate. Later that evening, after her shift, Sasha found Dr. Layla Khatri leaning against a wall in the sterile corridor, nursing a lukewarm coffee. Khatri looked drained, her usually impeccable bun slightly askew, the sharp edge of her ambition momentarily dulled by the day's events. When she saw Sasha, her initial look of surprise softened into something akin to embarrassment, then curiosity. "Nurse Popova," Khatri began, her voice quieter than Sasha had ever heard it. "About today." She paused, searching for words. "Dr. Tanaka mentioned your technique. He said it was unprecedented. And that you saved her life." Khatri pushed herself off the wall, took a tentative step closer. "He didn't elaborate. Just said you knew. That you just knew where to go." Her brow furrowed. "How? How did you know? What's your secret?" Sasha met her gaze, her expression calm, devoid of triumph or arrogance. "There's no secret, Dr. Khatri. It's just a different kind of training." She gestured vaguely. "I served as a combat medic before nursing school. In places where an ultrasound was a luxury, and an OR was often a tent with dim lighting. You learn to rely on what you have." Khatri listened intently, a flicker of something new, respect, entering her eyes. "We were taught to improvise," Sasha continued, choosing her words carefully. "To use all our senses. Palpation for subtle shifts in cardiac impulse, careful auscultation for the most minute changes in heart sounds, the way the jugular veins distend. And specific physical landmarks, the xiphoid process, the left sternal border, the angle of Lewis, not just as anatomical points, but as a map to what's going on beneath the surface. For a pericardiocentesis without imaging, you learn to feel the heart's tremor against the chest wall, to listen for the absence of sound where there should be some, to understand the precise angle to avoid the coronary arteries and the diaphragm, aiming for that sweet spot in the subxiphoid approach or the peristernal fifth intercostal space." She paused, remembering the intensity of her past. "It's about training your hands and ears to be your imaging. To understand the patient's physiology so intimately that their body becomes the diagnostic tool. It's not about being reckless, it's about making a calculated risk when all other options are gone, and time is the most critical factor." Khatri was silent for a long moment, absorbing this. "We're so dependent on our technology here," she murmured, almost to herself. "Our CTs, our echo machines, we forget what it means when they're not available." She looked at Sasha, a genuine admiration now replacing her previous skepticism. "You saw what we missed. You heard what we couldn't hear, even with all our monitors. You learned to filter out the noise," Sasha responded, thinking of the cacophony of battlefields. "And focus on the body's language." Their conversation was interrupted by the arrival of Dr. Tanaka. He stopped a few feet away, surveying the scene. His expression, usually unyielding, now held a complex mix of professional gratitude and intellectual curiosity. He hadn't publicly lauded Sasha, true to his reserved nature, but his actions spoke volumes. He had quietly ensured Aisha's case notes detailed Sasha's intervention, attributing the successful outcome to the critical, immediate pericardiocentesis performed by RNS Popova. "Nurse Popova," Tanaka said, his voice level but with an undercurrent of something unfamiliar. "Aisha Abdi is making remarkable progress. Her postoperative echo shows excellent repair and no residual effusion. Your timing was impeccable." He paused, then added, almost as an afterthought, "We'll be arranging for you to provide an in-service to the residents on unconventional emergency access techniques. Specifically, for situations where conventional diagnostics are compromised." It wasn't praise, but an invitation into a sphere of influence Sasha had never anticipated, a quiet acknowledgement of her unique expertise. It was Tanaka's way of extending an olive branch, acknowledging that the rigid protocols of Apex, while often life-saving, could sometimes be a blind spot. For Sasha, the immediate aftermath of the crisis felt like a quiet integration. She didn't seek fanfare, it wasn't her nature. Instead, she found a newfound quiet respect from her colleagues. Matteo, her supporting nurse during the procedure, now sought her out for advice on difficult IVs or subtle patient assessments. Other nurses looked at her with a mix of awe and a nascent understanding that true expertise wasn't always about seniority or letters after a name. Dr. Catry, in particular, underwent a subtle but profound transformation. She continued to be ambitious and driven, but her approach softened. She began to actively seek Sasha's input, particularly on patients with complex, ambiguous presentations, valuing Sasha's observational skills. The occasional dismissive wave of the hand was replaced by an attentive nod, the skeptical raise of an eyebrow by thoughtful consideration. Catry, initially protocol-driven to a fault, was learning that sometimes deviation from the textbook, when guided by deep experience and keen observation, was not just acceptable, but necessary. Aisha Abdi, after weeks of intensive care and rehabilitation, eventually walked out of Apex Medical Center, a living testament to an improbable save. Her recovery, while long, was steady, her prognosis significantly better than anyone had dared hope that desperate afternoon. Sasha, meanwhile, returned to her authentic life, which now included a new dimension of quiet influence. She remained the modest, observant nurse, but the internal conflict of hiding her true capabilities had dissipated. She found a quiet satisfaction in bridging the gap between her combat medic past and her civilian nursing present, realizing that her unique background wasn't a liability but an invaluable asset. Her wisdom, forged in the crucible of desperation, had found a vital place within the polished halls of Apex Medical. The incident subtly but significantly challenged Apex's rigid hierarchy. It wasn't a revolution, but an evolution. It affirmed that while advanced technology and strict protocols were the backbone of modern medicine, they were not the whole story. Sometimes, in the face of the truly unexpected, true wisdom came from the most unexpected places, from hands that had learned to feel the rhythm of life in the quietest of whispers, and from eyes that had learned to see clarity amidst chaos. Sasha Popova, the quiet rookie, had proven that profound expertise wasn't just acquired, it was honed, adapted, and sometimes, it was simply held, waiting for the moment it was truly needed. And in that moment, it could save a life, and perhaps, even change an institution. Sasha, now no longer just a quiet rookie, became an informal but highly respected consultant in critical situations, her unique insights invaluable. Dr. Tanaka and Dr. Catry, once rigidly bound by protocol, now actively sought her perspective, embodying Apex's evolving culture. This isn't just a story about a medical miracle, it's a powerful testament to the value of overlooked expertise and the profound wisdom found beyond conventional paths. It reminds us that true strength often lies in adaptability and a willingness to challenge assumptions. What are your thoughts on moments when unconventional thinking saved the day? Have you ever witnessed a quiet hero emerge from the shadows? Share your inspiring stories in the comments below. If you found this tale of courage and ingenuity inspiring, please hit that subscribe button for more narratives that explore the depths of human potential and the hidden heroes among us. Remember, sometimes the most profound lessons come from the quietest voices.